I am so fortunate to call Dr. Robert Clapper a friend, and we are so blessed to talk about what is truly one of the biggest stories in not just women's college basketball, but in sports, the injury to JuJu Watkins. Great to see you, my friend.
A pleasure to be here, always with you.
All right, when JuJu went down, I was immediately getting hit by a lot of USC fans. Who, what, when, where, why, how, a lot of things. Let's start with, we know she has an ACL injury.
Yes.
I've talked to you before, and sometimes, is it sometimes or all the time, that a person who injures their ACL should wait?
Yes. They should wait to let the swelling come down, let the range of motion, because inside the knee, there's the ACL. This is what we're talking about.
Yeah.
This is the medial collateral ligament, which helps the knee side to side protection stability. There's the lateral collateral ligament, the guy on the other side, the little toe side of your knee, stabilizes the joint side to side. Medial and lateral collateral ligament. But here's the one we're talking about. This guy in front, the ACL. A means anterior, in Latin means in front. Cruciate means it's crossed, so it goes at a diagonal angle. And the one behind it is the posterior cruciate ligament. But we're talking about the ACL. Why is it crossed? What benefit is it that it's at a diagonal? It's because this ligament helps with rotation of the knee, which means it's diagonal, helping with rotation, and also front to back stability. This is the one that she tore.
In my time, I remember when someone, Gale Sayers, tore his ACL. It's over, career ending.
Right.
That's not the case anymore. Why is that?
Because of technology. And as the proud son of a carpenter and a nurse, I brought some carpentry tools to explain why our technology now not only doesn't make this career ending, but you're going to see JuJu Watkins come back. I'm going to say better than ever, but she's not going to miss a step, no pun intended.
Yeah.
And the reason is the technology. And here's why. Let's look at a hammer.
Ball peen hammer, right?
Okay, and it's an old style one because you see the hole in the top
right,
with a staple that's driven. So remember the term, a hole on top. What we now do in surgery is we see the ligament that's torn, right?
Right.
And we use a drill. Kurt, do you have a drill handy?
You know me. I always come to work with my drill. You know what it's like in the sports office. You got to have a drill.
So we use a drill, different thickness bits, just like a carpenter uses.
Sure.
And we drill a hole with special tools in the operating room through the bone, and it enters into the joint itself, but it goes through the bone, the femur, the thigh bone. And we also drill a hole through the tibia where the ACL actually lands on the other side.
Wow.
So it originates from the femur and goes to the tibia. We drill a hole here as well through the bone with a drill. But here's where the big advance is, which is why I brought the hammer. We used to drive a staple, which would be irritating to other structures like tendons. We would have screws, which had screw heads that would rub against your skin and the tendons. We just were very archaic in the 60s and 70s
sure,
and 80s. But now, copying the idea of this hammer, where the metallic heavy hammer doesn't fly off the wooden handle because you drilled a hole, but this is what else you did. You drove a staple into the wood, and it spreads the wood so that it's fatter, it's tighter. This hammerhead ain't flying off the hammer.
That's right.
That's called an interference fit. Well, once we drill the hole with our drill in the bone, we then have different threaded screws that go into the hole we just drilled, just like the staple, and it spreads the new ligament, the graft, which we like to use your own body parts, through the tunnel, the hole we drill, through the tunnel. We bring the new graft and we bury the screw into the bone like that.
Wow.
Staples in the hammer. So there's nothing sticking out to rub against other structures.
So when JuJu eventually has this surgery, you said the graft. If I'm hearing you correctly, the graft will be her new ACL.
And it comes from either, you have choices. My preference is to use a little sliver of the tendon
Really?
in front, your own patella tendon. Just like you can have your appendix taken out and your gut is still just fine.
Right.
You can use this little sliver of the tendon, just take a little sliver of it, the body can handle it very nicely, and you use your own body part, and it's actually stronger than your own ACL. So it's very unlikely that it will tear ever again. In fact, you can argue it's stronger than it was before.
So we just saw Saquon Barkley win the Super Bowl this year with the Eagles. He had an ACL injury. Far be it from me to tell JuJu Watkins how to feel, but I would think that would give her motivation, not just by everything you're saying with science and technology, but he seems to be the quintessential example. You can come back strong.
And in basketball, Klay Thompson, Derrick Rose, Iman Shumpert, there's so many examples. You come back from it. And the other big advance, which is so wonderful, is fiber optics. Similar to what you have here in the studio, to be able to use these cameras that we use in the operating room. And believe it or not, Kurt, when I stick the arthroscope, the camera, through a puncture hole in your shoulder, your elbow, your hip, your knee, in this case the knee, I literally have my right hand here inside the knee, my left hand holding tools, but I'm not even looking at the knee. I'm looking up, just like you are, at cameras.
At cameras and monitors.
And we call that triangulation. A surgeon needs to learn the skill of having the camera here, the tools here, and their head is actually looking at the anatomy on the camera.
I think I've found my next story, and we're going to find someone who's going to let me in the operating room and do this with you. Hey, when I said I heard from a lot of USC players, you've always taught me everybody's different.
Yes.
But at the same time, everyone is similar.
Yes.
So many USC fans know she's already won one National Player of the Year award. She could win the biggest one, the Wooden Award. Is she going to be back next year? And I know you can't make any promises, but what's the average duration? What should USC fans expect?
We know Adrian Peterson came back in 8 months as a running back. And no one wants to put any pressure on her. It's a non-contact injury, and it's not from a collision. So psychologically, how does that play into it? And no one can really predict. But, she could certainly return to playing basketball 8 months, 9 months afterwards and really ramp it up.
Wow.
So wherever that lies in terms of the calendar. But the one thing we really want to emphasize, because she's going to be a trailblazer for many other athletes, because now that we enjoy so much in women's sports, women's soccer, women's basketball, as an orthopedic surgeon, guess what we see? We see almost five times more ACL tears in girls' knees
than we do. Why is that?
So again, it always goes back to the anatomy. Two big reasons. One, a woman's pelvis is wider than a man's. So if the pelvis is wider, you still have to get to the knee when you make a move, but you're coming from a wider angle. That angle puts stress on the inside of your knee joint with a wider angle, and it causes more torque. That's one reason. The second reason is, look here at the ligament. Look at the space in the knee joint. We call that the femoral notch, clearance for the ligament. Well, the reason this ligament tears when you plant your foot and twist is because this bone snaps it. And if the space is a little too tight, the clapper vision I like to use is, the ligament is a car, the garage is rectangular. You pull into your garage, plenty of clearance on either side of the car and the ceiling, right?
Right.
But what if you're pulling your car into an A-frame, like a Native American teepee?
Right.
More of an A-frame, less room, you're more likely to snap your ligament.
That's a great.
And so you don't know if you're born with more of a narrow notch, so you don't need much movement to snap the ligament.
And that's called what?
The femoral notch.
The femoral notch. Now, the angle, I never knew anything about a femoral notch. You're a doctor. I'm a sports guy. I was in journalism class. But I will say, I do remember geometry, the vector.
Yes.
It's the angle is what you're telling me.
So,
probably because of the way women are built to bear children.
So you are the beloved representative of the Rams for all of us. and you're very aware of one of the worst penalties in football is clipping.
Right.
What's clipping? Clipping is you're running and you get hit
At an
from
angle.
the side, and that snaps the ligament.
Gotcha.
That is why it's ruined many careers. Now we can rebuild the ligament, but that's why that's a penalty in football.
Dr. Clapper, you're brilliant. You paint a great picture of Clapper vision. We're all blessed and smarter to have you, my friend.
It's a
Thank you.
pleasure to be with you always.